I'm Bobby here, and let's queer up politics. New York lawmakers propose lifting AIDS-era ban on LGBTQ plus bathhouses. New York State's lawmaker Erik Bottcher is introducing legislation to lift a 1985 prohibition on commercial bathhouses enacted during the initial surge of the HIV/AIDS crisis. The Public Health Modernization Act seeks to dismantle the AIDS-era sanitary code regulations that effectively shut down adult bathhouses across the state. In place of prohibition, the proposed legislation would establish state licensing guidelines and updated public health standards for adult venues. Advocates and public health scholars argue that the 1980s era closures fail to reflect modern medical science, such as the availability of PrEP, PEP, and effective antiretroviral treatments, and instead stripped marginalized communities of vital social-cultural spaces. If passed by the legislature and signed into law, the measure will allow adult bathhouses to reopen legally under the standardized state public health and safety protocols. Well, so look, I wasn't even recognize the fact that I was gay back then when these closures happened. I mean, this is now 40-something years ago, and
you were like 4 when this happened, Bobby.
Yeah, exactly.
At most.
And the truth is, back then, it might have been necessary to prevent the spread of the epidemic because people were less educated about safe sex and all that stuff. But just like the blood donation ban, these are narrowly tailored to target LGBTQ spaces. I mean, other bathhouses exist today in New York City.
Absolutely. It's
just not, but they were targeting specifically bathhouses that cater to the LGBTQ community, specifically in this case, the gay male community. And there's now 2 generations of LGBTQ people in New York who have never even experienced a bathhouse or even heard of one before. I mean, back in the day, in 1970s, one of the most famous bathhouses in New York was the Continental Baths, featuring a very young Bette Midler singing piano, accompanied by a very young Barry Manilow. Yeah. I mean, both are, much older now, and much more famous. But yes, back then, bathhouses are not just for hooking up, but they are actually cultural spaces for gay men to gather in the days of criminalization and marginalization.
Oh, you're like, I'll see old historical footage of the bathhouses in New York City back then. Oh my goodness, it was like a whole event back then. And you look at modern bathhouses and most of them are like the saddest things you've ever been in. It's all men who don't talk to each other. It's very weird. And I do like the Club Fort Lauderdale. I've only been once, but they have a pool and a hot tub. I like to hang out there. But on the whole issue of the blood and closing the bathhouse, we say was this about, we didn't know about safe sex. It was more the medical community really was so in the Stone Age in the 1980s, well, not just on this, but on so many different issues.
As someone before I even came out, but I remember seeing articles in Time magazine in the early 80s and knowing people and coming to terms with who I was in high school, but knowing gay people and saying, there were rumors you could get AIDS by sharing a fork. And I had a very close, openly gay friend. And, I said, this is ridiculous. I'm not going to get HIV from sharing a dessert and tasting what he has with the same fork. But we've come a long way. I think we need to look at, as a society, isn't it better for people who have sex with men or they're gay, however you want to identify, being in a safe space rather than possibly having a bad hookup and having a happy outcome.
That's why I've talked about why we banned them in the first place was really the failure. Failure might be a too harsh word, but the medical community didn't know how to handle it back then. But we know now. There's no excuse to continue some of these old policies. Some of it's still homophobia, the blood ban stuff. I've heard, as recently in the last 5 years, members of the medical community say, well, we've had to ban gay men from donating blood because there could be unseeable and undetectable pathogens in their blood. I'm like, that's fairy dust, honey. That is insane to say that there's undetectable pathogens.
It could also be someone who is heterosexual who's never had sex.
But something that cannot be detected by anything by known science.
Well, you know, I think
That's homophobic.
of course it is.
And also, you know, just to clarify that across the world, straight people suffer as much from HIV/AIDS,
if not more.
than our community. And at
Especially-
least these days, our community is a lot more educated. I mean, go to any of the community centers, Wilton Manors, San Francisco, New York City, Chicago. PrEP is everywhere. Everyone.
Well, yes,
and
you know,
their mothers on
And
it.
you look at some folks who don't have these resources in, you know, the African continent and other third world countries out there. Where, you know,
we were funding those initiatives.
Absolutely.
I mean, PEPFAR and all that stuff, but of course, those things were dismantled by the forces inside 1600 Pennsylvania Avenue.
Speaking of third world countries losing HIV funding, I think of the third world country known as the American South. Look at what's happening in Florida with HIV funding.
Yes.
Texas, Mississippi, it's been a huge issue down here.
Yeah, and we can't return going backwards. Absolutely. Well, a lot of good commentary. There is no other queer nonprofit media platform like this in the entire world. Support our LGBTQ stories by sharing them and subscribing to Queer News Tonight.